I think we still have to work on making sure that everyone has health care and that there is access, and there's still work.
Of all forms of inequality, injustice in health is the most shocking and inhumane. Martin Luther King Jr., 1966.
When someone is discriminated against, they can't get help or don't want to take the extra measures to take care of their health. Because healthcare discrimination exists, the awareness of one's health is decreasing, and the amount of healthcare problems one experiences is increasing. Therefore, we must do something to stop this. We all have the right to be treated equally, regardless of our race, class, religion, belief, gender, language, and so much more.
So, what do you do and what's your career?
In my full time job, I am a specialist three. That's our title for LA Care. In my role, I assist in community outreach, so bringing in people into the center to access our services. Part time job, I work for a small nonprofit called Books and Buckets as their deputy director.
And why is it important to keep track of your health?
I think in a personal aspect, it's important to keep track of your health so that we can live as long as possible, right? It's been a relatively short amount of time where our life expectancy has been able to be increased because of modern medicine. And so keeping track of our health, will allow us to, enjoy that increased lifespan, right? In a cultural aspect, right? As long as we continue living, being on top of our health, we can continue the traditions that our, families have passed down, right?
Discrimination in healthcare is defined as negative actions or lack of consideration directed towards an individual or group. The rates over the past years have rapidly increased. Shockingly, workers have even witnessed discrimination against a patient. 47% of healthcare workers nationwide have witnessed discrimination against patients in their facilities, and 52% say racism against patients is a crisis or major problem, according to a news report from Commonwealth Fund and the AARC.
What are some examples of discrimination in healthcare?
Big ones that I kind of see a lot is, racial discrimination and also socioeconomic discrimination.
My name is Jesse Gonzalez. I'm an RN. I work in St. Mary's Medical Center. I've been an RN for 2 years. I work in the ICU department and I serve it, to the Long Beach community. Discrimination can take many forms. For example, patients who may be treated different due to the race, ethnicity, gender, or sexual orientation. For example, a family that doesn't speak English, and if they get a nurse that only speak English, like they may have a different. The nurse may treat them different because there's a language barrier. So that's just one example. Other one would be for your sexual preference. If the nurse is very close-minded, they obviously gonna treat the patient different too.
So, Mr. President, for this to come to an end, we need solutions. One possible way to solve this issue is to have more people from minority groups in the medical field. We are currently in a shortage of nursing, which allows us to open the eyes of the youth and bring awareness of an amazing job opportunity in the future. We can begin by implementing classes, programs, and workshops that will gain the interest of the youth. To ensure there's diversity in the medical field, we should target schools that come from neighborhoods with high diversity for change. The more people coming from similar experiences and backgrounds as are nurses or doctors, the more likely it will be that people will gain trust in not only the worker but also the healthcare system. This will not only allow us to ensure the safety and respect of the patients but also the workers. In conclusion, healthcare discrimination is an important issue that we lack to see. It is constantly looked past, but we must do something to put an end to this injustice. If we don't do something to stop this issue soon, our population's health problems will increase severely, and the discrimination and shortage of workers in the medical field will continue.